Hello guys, and welcome back to my channel. My name is Hannah and this is my channel Naturally Hannah. So today I will be talking about my pre-reg and my pre-registration year and kind of like what that entails, and from my opinion and the kind of things that I went through, are still going through because I haven't finished yet, and also answering your questions which was sent on my pharmacy Instagram, which is PharmaHan, and I kind of asked you what kind of things you'd want to know about hospital pre-reg / GP and whatnot, and yeah, I'll be answering them. So that will be at the end of this video. So if you'd like to know more about hospital pre-reg / GP pre-reg / hospital and GP pre-reg, then continue watching, and if you've asked me a question, then your questions will be answered in this video. So pre-reg, which I think I've already spoken about, is something that you do after you finish your MPharm degree. So it's just another stage to help you to become a pharmacist. So pre-reg is 52 weeks minimum. So you have to complete 52 weeks in a pharmacy setting. So that can be a community pharmacy, that can be in a hospital, you know, whatever it is. And you can either do a singular pre-reg, which would just be purely hospital, purely community, or you can do a joint pre-reg, which is what I am doing, which is hospital split with GP. You could do hospital split with community, you could do hospital split with industry. It depends what you want, and you can have a look at all of that that is available on the Oriel website. So it will tell you, you know, when you're picking what you want to do, it tells you what pre-reg places are open and whether you want split or whatnot. So I chose GP and hospital placement as my first choice. So that was because in my fourth year, I think it was, my university was kind of doing a pilot for GP, like pharmacists in the GP, because pharmacists and GP is kind of fairly new-ish, like to have pharmacists in the GP. So my university, they did like a kind of pilot where I was able to go to, that I applied to, and I was able to go to a GP practice with a 5th year medical student, and we used to work together to see patients and give like recommendations and stuff. So I really enjoyed that. So I thought, you know what, GP, hospital, why not? And also the kind of person that I am, I don't really like to do things again and again. I kind of like a change, you know? Be here for 1 minute, then change the other minute, so I don't get bored. So I decided, you know what, I enjoy GP, I'm sure I'll like hospital, so I decided to do it. Personally, I didn't pick community because I had previously worked in a community for 4 years, and I loved that community pharmacy. I absolutely loved it, but I just knew that like it wasn't really the direction I wanted to go in as a pharmacist. I wanted to be rather a hospital pharmacist, and then possibly in the future a GP pharmacist. So that's why I chose hospital and GP. So pre-reg year, so like I said, it's 52 weeks and you are assigned a tutor. So you're assigned a pharmacist as a tutor, a senior pharmacist, and they're supposed to be the one who kind of signs you off on your competencies. So they meet with you, at least in my hospital, they are supposed to meet with you at least every 2 weeks. It might be longer than that, less than that. It depends what kind of tutor you have. I have 2 tutors. I have a hospital tutor and also a GP tutor. You have 76 performance standards that are set by the GPHC that you're supposed to meet during your pre-reg year. So these 76 standards are kind of like behaving in a manner consistent with the profession, providing advice and information to healthcare professionals, taking part in quality improvement process, helping patients achieve their maximum benefit from their treatment. So it's just these kind of things where you're supposed to do that are supposed to prove that you're going to be a good pharmacist, and the kind of things you should be doing as a pharmacist anyway. So those are the 76 standards. So you have to write evidences, at least in hospital. I've heard in community that some people don't write evidences, but anyway. But in hospital, you have to write evidences to show that you meet those standards. So things like when you've helped a patient, you've done a drug history, you found that the patient is not taking something, but the doctor has prescribed it, and then you make a clinical intervention on it. So you would write an evidence on that, and then you take the standards that meet that evidence. So you have 76 standards to prove that you meet that evidence. Most times they want about 5 evidence pieces to be written to meet the standard. So you go on this website called VQ Manager, and then you write in your evidences, and then you submit it to your pre-reg tutor. You can also submit it to like a witness, which is somebody who saw you do what you do, so you can't just like make it up. Obviously, that wouldn't be good. So you submit it to your tutor or a witness, and then they see it, and they look at the standards that you've ticked, and then they decide whether or not they agree with it. And then at your appraisals, so you have 3 main appraisals. You're supposed to have at least 4 appraisals throughout the year, but so far I've had 3 main appraisals. So that's your 13th week appraisal, your 26th week appraisal, and then your 39th week appraisal. So at your 39th week appraisal, you're supposed to have at least most of them signed off, and it's also supposed to be the time where your tutor is supposed to sign you off to say that you're competent enough to take the pre-reg exam. So you can't just take it. Your tutor also has to say, okay, I think they're competent enough to take the pre-reg exam. So obviously with this year it was different because the pre-reg exam got cancelled, postponed due to coronavirus. So I didn't really have that experience of my tutor signing me off for my exam. But I did have my 39th week appraisal and your 13th and your 26th. At your 13th week, you're not really signed off on a lot of standards, obviously, because you've only been working for 13th week. But you are supposed to sign off and prove more and more standards as you go through the year. So when you have your appraisals, that's when they will tick off and say, yep, the standard is done. You have now signed off, 20 out of the 76 standards. So you're working towards signing all of them off by the time you finish your pre-reg year. Within hospital pre-reg, apart from those 76 standards, you also have competencies that you need to meet. So in my hospital, we had to do our dispensing competency, which is like dispensing medication, labeling it, picking the right medication and that kind of thing. You had to do 500 items correct with no major errors in a row. So you have to do it continuously. If you made like a major error, like you picked the wrong thing, then they'd either make you start again, depending on where you were, or they'll add on like 100 more items for you to do. So that was very long and very stressful. But thankfully I finished that by now. Then you also have your final check competency, which is like when after it's been dispensed, and then you're checking it before it goes out to the patient. So you will check it, and then somebody who has finished their competency will check it again, and then you also have to do 500 items of that. I think within different trusts, within different hospitals, the number that you have to do changes, but I'm pretty sure most, if not all hospitals, I say I'm pretty sure, but with my friends who are pre-regs in other hospitals, they also had to complete the same thing, like do competencies and stuff to be able to do this. In community, I think it's a little bit different. They don't really have to do as many competencies, if I'm correct. If I'm not, then let me know. But yeah, so you have to do your competencies and you're doing your final check without any errors, and then when you've done your 500, you're signed off. And then there's another competency for counseling patients as well. So when you're handing out the meds and telling them like, oh, take it with water and don't eat it before food and that kind of thing, and telling them, oh, you should take it like this, don't take it like this. If you experience any of these side effects, then get in contact with your GP or your pharmacist or whatever. So you also have a competency on that, and then you have a competency on final checking for chemotherapy. So that's different as well, where you have to check chemotherapy drugs, obviously because they're high risk, so you have to get it right. And then there's another competency on counseling for chemotherapy as well. Yeah, there's a lot of competencies in hospital that you probably wouldn't get in community. For example, chemotherapy, you probably wouldn't be exposed to chemotherapy in a community pharmacy. So yeah, you have those. Then you have your seminar days. So for us, we are aligned with another hospital that also does pre-reg. That's a bigger hospital, and they provide seminars for the pre-regs, so things that would be helpful, so like cardiology, pediatrics, topics that would be on your exam. So they provide that for us as pre-regs. So we would have those normally every week, at least, maybe more, or at least every 2 weeks or something like that. Obviously those were cancelled because of coronavirus, so they put those on hold, so we haven't been attending them. And they also do like calculations workshops and stuff, which is really great and really helpful for your pre-reg exam. So when you're a pre-reg, you're affiliated with a university. So I was affiliated with DMU because of the area that I'm in. It depends on what area you're in. So they used to provide regional days, which would occur normally at least once a month. So again, these regional days were not only to help you with your to help you with your pre-reg exam, but also to help you transition into a pharmacist. So they would do, things on consultation skills, and they'll do stuff on OTC, and they'll do OSCEs and mock exams and whatnot. So it was really, really helpful. Again, because of coronavirus, they kind of cancelled them because it was gathering of pre-regs from different hospitals around the area. So they cancelled that, but they were really, really helpful. So whilst you're doing your pre-reg, you're thinking about doing your in-house competencies, so your dispensing and whatnot, the ones that I discussed about. You also have to think about your evidences as well, and then you have your rotations. So in terms of your rotations, depending on what hospital you go to, you may have more, you may have less. It depends on how many specialities they have. So for example, you'd have cardiology, you'd have a surgical rotation, you could have a pediatrics rotation where you're spending times on the pediatric wards, spending time on the cardiology ward. I mean, if it's a bigger trust, you can have an endocrinology rotation. Loads of different rotations that you spend your time through. So most rotations about a month. My rotations were slightly shorter because I was split with my GP pre-reg. So my rotations were about 3 weeks, maybe 1 week less than everybody else's. So to make space for my GP rotation as well. So you have your rotations, and then within your rotations you have competencies that you need to meet. So for example, they'll give you like a handbook or a workbook that's supposed to supplement your learning, and you're supposed to use to like complete and learn more about it. You can meet with the supervisors as well, present patients to them, patients that you've made a clinical intervention with, and that's pretty much it on your rotations. I think they are really good. Obviously in community you don't get to have rotations because you're normally just in one community. In hospital pre-reg, even if you're not doing a community split, they do normally give you time in community, and sometimes in community as well. Even though you're not split, they'll normally give you time in a hospital. So maybe like 2 weeks or so in a hospital setting, or 2 weeks or so in a community setting. With all of those, you also have to revise for your pre-reg exam, so don't forget that. At the end of the year, normally in June time, that's when it was supposed to happen, at the end of June, before coronavirus came around, you have to do your exam. You have to sit your exam at a maximum 8 years from when you start your MPharm course, or 4 years from when you start your OSPAP course. If you don't know what OSPAP is, check out my video on how to become a pharmacist in the UK if you're from international. So you have to do that, and you only have 3 attempts on your pre-reg exam. And then with GP, I also had other competencies to meet, so like clinical examination skills, so like taking blood pressure, heart rate, that kind of thing. Examinations. I also got to do health checks, so that's when I'd have a consultation with the patient, and we'd like talk through how to give them healthy living advice and how to improve their health and that kind of thing. And I also got to do medication reviews with patients, so talking through their medication, seeing how they're getting on with stuff, looking at their blood results, and maybe making adjustments and stuff on what they should do. So say for example, if they're on levothyroxine and the TSH levels or the T4 levels are a bit weird, so need to increase the levothyroxine or decrease the levothyroxine and whatnot. So also that was under the supervision of my tutor, who is a GP pharmacist, so she was able to do that because she was a prescriber. That was kind of what happened in GP. I think right now we'll do the questions and we will see how this goes. So what are your roles? So in hospital, My roles were mainly working in partnership with the pharmacist, like the ward pharmacist and the pharmacy technicians. So that would be doing drug histories, clinically assessing patients, making interventions, that kind of thing, under the supervision of a pharmacist. So you were allowed to work quite independently. So you would see your own patients. You would be allocated a bay, for example, on the ward, and you were in charge of those patients. So you would do their drug histories, you would review their charts every day. If there's any clinical interventions that need to be made, you'd speak to the doctor, tell them, oh, do this and this instead of this and this. And you'd also present these cases to the ward pharmacist as well, if you needed support. So yeah, that was kind of my main role in hospital. And then you also have your dispensary role. So that's coming to check prescriptions if you need to, or dispense if they're overwhelmed or something like that. So that was the main role in hospital. What did you like about it? I love hospital and I love GP. I loved hospital because you saw a lot. Like, there is a lot to see in hospital, because if a patient can't be dealt with in the community, or it's too complex, then they come to hospital. So I saw a lot of weird and wonderful things that you probably would never see in community, which is something that I really enjoyed. And you would learn a lot on the job. You learn so much on the job. So that's what I enjoyed the most about hospital. GP felt like a vacation from hospital, because it was a little more slower pace. You were allowed to sit down, you saw patients on like one-to-one, having your own consultations, which is what I loved about GP. I absolutely loved it. So what did I hate about it? Hospital, I think, is very intense. I think that you have a lot on your plate, a lot of competencies to meet, as well as writing your evidences, revising for your exam, and finishing these handbooks and stuff for your different rotations. I think that's probably what I hated the most about it, the workload, because it's a lot. It's actually a lot, and it feels like there's not enough time, but you get through it somehow. But yeah, that's what I hate the most about hospital. In terms of GP, I just love GP, to be honest. I don't think there's anything I hated about it. I'm not gonna lie to you. I think maybe because it was new. No, there's nothing I didn't like about GP. I loved it. I loved the people. I loved the place. It was bliss. It was bliss. Okay, roles and responsibilities. So I think I've already talked about my roles and responsibilities. What's the most difficult thing I had to do? So the most difficult thing I had to do was what I said before. Balancing all of the different things can be a lot. It's a lot. Also, in hospital pharmacy, you are with a lot of people, so you meet a lot of people all the time. Like, it really, really works your interpersonal skills, because every day you're meeting somebody new. You change a new rotation, you have complete new set of doctors, you have a new pharmacist that you need to get used to, new technician, understand how they work. You have to be so adaptable in hospital. I think in community, because you're normally with the same people day in, day out, but then with hospital, it changes so much. It always changes. So yeah, you have to be adaptable with hospital pharmacy. How much is the pay? So in hospital pharmacy, as a pre-reg, you start on a band 5. So band 5 is about 24,000 in the north, and then in the south, I think it's about 26,000, because down south the cost of living is more, so salaries are a little bit higher. I think it's 26. I'll have a look. So the interview process. So this is again through the Oriel system. I think I've done a video kind of on Oriel, so you can check that out. So hospital pre-reg is purely through the Oriel system. You can only get it by applying through Oriel. I know Oriel is different now because you don't have MMIs anymore, which honestly, in my opinion, I think is great, because MMIs were the most difficult part of the Oriel process. So the best way to prepare for hospital pre-reg. So I'd say maybe brush up on your clinical conditions. I say this, but I don't think you really need to do it, because you really do learn a lot on the job, and you will find your weaknesses when you're on the job. But probably like blood results, maybe brush up on what blood results mean, if something is too high, too low. Also abbreviations, because you know when doctors write in notes, they use a lot of abbreviations like TIA, HTN, that kind of thing. So brush up on that. I think that's all the questions. This video has been long, so if you made it this far, I'm proud of you. I'm very proud of you, because I don't know if I could have myself personally. But I hope you enjoyed this video. Don't forget to like, comment and subscribe. If you have any questions, then of course, you know, ask me and I will answer them. And share this with anybody who is currently in their 3rd year of pharmacy or their 4th year of pharmacy, or you know, any year of pharmacy. Do you even have to do pharmacy? No, you can just share it if you want to. So thank you for watching, and I'll see you in my next video.